The World Blood Donor Day will be celebrated on Saturday, June 14th to raise the awareness of the need for safe blood and also to thank unpaid blood donors. And to discuss this with us this morning, the importance and what we need to know about blood donation, we have with us Dr. Angelina Mirasol of the Philippine Society of Hematology and Blood Transfusion. Good morning, Doctor.
Good morning, Claire.
Good morning. So does the country have enough supply of blood right now to accommodate the ones who are in need?
Actually, we have improved a lot since the last decade in 1990s. So from the last survey that was conducted in 2011, I think we have reached the 1% mark, which according to the WHO is sign of being adequate. Unfortunately, the problem locally is the distribution of blood. So concerning adequacy, we have enough donors, but we need to be able to distribute it properly to those in need of blood.
So where does it falter, the distribution of blood? Why do we need to improve on that?
There is a need for proper networking. And remember, we are an archipelago and we have islands, so that is the challenge. So there is a need for better networking in our country.
So for like far-fetched places that are hard to reach, it's hard to deliver and to find out who are those in need.
Yes, definitely.
So it's more of communication and organization.
Yes, definitely.
Okay.
Clear.
Now also for those people who are thinking of donating, who are eligible of being a blood donor?
So ages 16 to 65 years old can donate blood. In fact, for those above 65 years old, they may still donate blood if they are healthy. And for 16 and 17 years old, there's a need for parental consent, or they should have a letter from their parents that they're allowed to donate blood.
Anything else that they need to consider? I think height, weight.
Yes. So at least 50 kilograms if you want to collect at least approximately 450 ml.
Is that almost like a pint? I understand.
Yes,
it's about a
right.
pint.
Yes.
Well, no, about a pint like this, like a pint. I'm thinking of a pint of ice cream.
It's about 450 ml.
Okay.
Yes. But if you're less than 50 kilograms, you can still donate blood.
You can.
Yes, but you will be using a much smaller bag, approximately 250 or 300 ml.
Half. Okay.
Yes. But we do encourage 50 kilogram blood donation because this can further be divided into blood components.
Okay. And how often can you donate blood?
Okay. You can donate as early as after 8 weeks. But if you want to be a regular donor, it is preferable that you donate approximately 3 times a year. That is for whole blood or if you're donating for red cells. But if you're donating for components like platelets, you can actually donate after 3 days or after 1 week.
Okay, so it depends on what you're donating, what it's for, basically. And what are the risk factors that are involved in becoming a donor and also for those who are receiving the blood donation?
Okay, there are potential risks if we don't follow the proper SOPs or policies in blood collection and blood transfusion. So if the institution doesn't follow the recommendation of the Department of Health as actually been provided by the international communities, then there's the potential of infectious disease transmission if you repeatedly use the needles. But it is mandated in the Philippines, definitely all are disposable. So it is safe to donate in the Philippines. And what is important is that we emphasize in blood donation, there are 2 people we are concerned about. The patient, the person donating the blood, who is the blood donor, and the recipient or the patient receiving the blood. So both safeties should actually be taken into consideration.
Okay, so for those who are donating, do they get background checks and what do they check if you're donating blood?
Definitely, it ranges from the age you take note of height, weight that we have already mentioned, the history, for example.
Like medical condition, like
yes.
when do you say no to a blood donor? That you can't donate blood?
If the patient has, if the person donating or the blood donor has a recent tattoo or ear piercing, they may
Yes.
actually be deferred for approximately 6 months to 1 year.
Okay.
But it doesn't totally defer them. After that period of time, they can already donate again. So persons with cancer, persons with chronic debilitating diseases are actually deferred permanently. That is for their safety as well as for the safety of the recipient of the blood. So for those that are temporary or let us say reversible illnesses like viral infections, after a period of 2 weeks from recovery, they can already donate blood.
Okay,
So,
every once in a while I know that there are people who are in need of blood donors, and you know, it gets even posted on social media that, oh, we are in need, if anyone is type this, type that. So if they are in need, where are the places? Please inform the audience, where can they get these blood donations from?
okay, we have a lot of centers for blood donation in the Philippines, but the main center, especially in the National Capital Region, include one, the Philippine Blood Center, which is now situated in the Lung Center of the Philippines area. So, which is the Lung Center of the Philippine area. And another are the branches of your Philippine Red Cross. The main branch is in Port, at the Port area. Also, if you want, you may also donate in hospitals like the Philippine General Hospital, National Kidney and Transfusion Institute hospitals, and other institutions which actually have blood banks.
Okay, and what is the percentage that, you know, possibly that they can get a blood donor to donate blood to them if they are in need of a blood transfusion?
Okay, the percentage of blood, okay, among those who donate blood.
For those who are in need.
Okay, for those in need, we have actually improved a lot. As of now, I would say that probably more than 80% of 90% of the blood needs are actually being provided for in our country right now.
So for those who are in need, it's about 80-90% chance that they can get someone to donate for them.
Yes,
through the facilities that, through the areas and hospitals and facilities that you mentioned.
Yes, but certain facilities have their own responsibilities. Like for example, this institution will cater to the patients admitted to their institutions.
Oh, okay.
But if they have excess blood, they can actually share it or
Okay.
network it to other hospitals.
Okay. And now this year's theme is Safe Blood for Saving Mothers. Lastly, why is it specifically for mothers?
Thousands of mothers actually are lost during delivery and secondary to complications associated with pregnancy. It is just right that we actually give blood, which is very necessary, especially for bleeding episodes during delivery, among those who give lives. And these are the mothers. So if we have enough and safe blood for the givers of life, then we can save thousands of lives every year.
We can save more mothers as
Yes,
well. Well, thank you so
definitely.
much, Dr. Mirasol, for coming over. Thank you.
Thank you.
Thank you. And that was Dr. Angelina Mirasol of the Philippine Society of Hematology and Blood Transfusion.